The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Deanna Mitchell with Leading Age Michigan, and welcome to our July 24th Safe and Calm update. This past week has been a very busy one with a lot of new guidance and directives, most of which were anticipated, and at least this week there were very few new surprises. Today, our agenda is rather standard. Dalton will give us a very brief advocacy update on what is moving at both the state and national level. We will take only a very brief look at Michigan numbers, and we're going to do a bit of polling today as well. And as usual, then we will end with guidance updates and other resource information. So at this point, we'll turn the presentation over to Dalton for his advocacy update.
Good morning, everyone. It has certainly been a busy week for the legislature as they are they were in until yesterday, and they won't be returning until sometime in August. Since it's an election year, they are spending a lot of time in district, working in district, and kind of running their campaigns to get reelected, especially members of the House. So today, our first slide is going to be about the budget deal that was reached on Wednesday. It largely followed what was predicted it would follow. It was a combination of funding transfers, utilization of the state budget stabilization fund, and a backfilling by the CARES Act dollars. It's interesting, this time, instead of it being following the traditional process, like this legislature and governor seems to like to do, they were a little outside of the box and did it through a combination of House and Senate bills and an executive order, Executive Order 155 in particular. For the DHHS budget in particular, we saw a lot of funding transfers in that budget. So you'll see, if you look at the document, you'll see reductions, but really those are just caseload adjustments and them removing some of the excess dollars generated from the increased FMAP to other places in the budget where they could. Important to note, providers who rely on the Medicaid waiver program will see a reduction there, but that is just a reduction in caseloads. And this budget, like we've been saying, largely leaves the hard decisions for the FY 2021 budget. Those negotiations are set to begin in this September, after a conference revenue estimating conference concludes in August. And right now, Michigan has no federal monies to backfill FY 2021 because we use them all to backfill FY 2020. So you'll see, and we have seen, calls from members of the legislature in the state and the governor to the federal government for more federal assistance. And right now, from what I've been hearing, that isn't on their mind at all. So we'll see. It'll be an interesting FY 2021 budget negotiation process. In other news, the provider liability protection bill and the dedicated COVID facility bill that we've been tracking throughout these webinars both passed on Wednesday. Interestingly, they passed very narrowly and were not given immediate effect. And so what that means is if these bills are signed by the governor, which we don't think they will be, she's indicated publicly that she's probably going to veto both of these bills. If they were to be signed, they wouldn't go into effect until April 1st, 2021. So that does kind of throw off some of the dates, especially in the COVID facilities bill. But the liability protections do apply retroactively. So if she does sign those, the provider liability protections will still be put in place, but she's not likely to sign them. In interesting national news, you may have heard President Trump on Wednesday announce that he is doubling funding for nursing home providers. There was $5 billion set aside out of the CARES Act, or $4.9 billion technically, and he increased that by $5 billion more for nursing home providers. These funds can be used to offset revenue losses and assist with additional costs relating to the public health crisis and the purchase and procurement of PPE. To be eligible for these funds, providers will need to participate in an online nursing home COVID-19 training program that's going to be rolled out in the coming weeks. The program has 23 modules and is focused on infection control and best practices. Interestingly, this increase in funds also came with a requirement that all SNFs test staff every week if the state that they are working in has a 5% positivity infection rate or greater. And Leading Age National has released statements in the media and sent things to CMS saying that thank you for the assistance. We do need more assistance, but this testing just places undue burden on providers. In HUD news, just yesterday, Ben Carson announced the termination of the affirmatively furthering fair housing regulation that was issued by the Obama administration in 2015 and replaced it with a new rule called Preserving Community and Neighborhood Choice. The AFFH rule was designed to promote fair housing around racial discrimination and racial bias within communities, and required communities to do a review of where their housing was located in order to meet racial disparity needs. This new rule removes that requirement and defines fair housing more broadly to mean that it is affordable, safe, decent, free from unlawful discrimination, and accessible under civil rights. And fair housing now means that any action that is taken rationally to promote those things I just read equals fair housing. We won't touch on the rest of the slide. There's a link here to the actual statement. Leading Age National has released statements that they oppose the change. So yeah, moving forward. In other interesting news, Leading Age National partnered with Leading Age Florida to release a report called the Florida Situation Report that focuses on how COVID-19 in Florida is affecting seniors. They chose Florida because, as you know, Florida is pretty nationally well known as a place where COVID is kind of just running rampant a little bit. And here's some interesting stats regarding long-term care. I won't read them out, but you do have a link to the full report there if you're interested in what's going on in Florida. It's very troubling. As I said, that National partnered with Florida as part of the Act Now for Older Adults campaign, which we've covered on past webinars. This campaign is an advocacy campaign that Leading Age National is using to promote older adult awareness during the pandemic. Their campaign focuses on promoting 5 essential actions for Congress to take. Those are to promote immediate access to ample and appropriate PPE for all providers, promote on-demand and fully funded access to rapid testing solutions, consider the health and safety of older Americans in states' reopening plans, funding and support for aging services providers across the continuum, and recognition for frontline workers who are doing the direct care work during the COVID-19 crisis. I included a link there to take action that'll take you to an online email form that Leading Age has already written, and you just insert your name and address and it will send it to the appropriate congressional leaders.
All right, thank you very much for that, Dalton. Leading Age Michigan would like to thank our business partners for their continued support during this pandemic, and we encourage you to take a look at the names of the organizations on the screen. These organizations continue to support our associations and your and your association or your organization as well. Without their continued support, the Education Foundation would be unable to be as dynamic and innovative as we are. Therefore, when you are considering a purchase of goods or services, please remember this page of names and consider making a purchase from one of these fine organizations. Right now, I just have one question, and that is, can Leading Age Michigan consider some additional training related to the new HUD revision?
That's certainly something we'll look into, and I will forward that on to Laura Fuller, our Director of Education. She's always looking for more education opportunities, so if you do think of something, please feel free to reach out to us. We're always looking to promote education and well-being of Michigan seniors, so thank you.
All right, it looks like that is good, so we can go ahead and move on, Deanna.
Okay. Thank you, Dalton and Blake. Today we're only going to look at the most recent situation summary for Michigan as of yesterday afternoon. Our routine slide is the 7-day moving average. And this seems to settle down a bit for the past few days at least. This could be good news if new cases are actually stabilizing a bit. We'll have to watch this over time because we all know that there is often a lag in reporting, and we want to see if this is really maybe a new trend or if this is just a plateau for a moment. But it does look better than it did when it was spiking about a week or two ago. The 7-day moving average new deaths has not really surged in response to the new caseload numbers, but there were several days of slight increases over the past 2 weeks, and we've seen that that's calmed down a bit as of yesterday. The overall trend seems rather flat with relatively low numbers, so that is very promising. So our final discussion about the situation update today includes a look at the MySafe Start map. It has not changed since Wednesday, although it did change from last week. Although the average test positively did rise from 3.3 to 3.4% as of data collected through 7/17. So even though caseload seems to be stabilizing, our percentage of positive cases went up just a bit, and that's something to watch as well. It is important to note that this map is not necessarily updated more than weekly, and there's always a bit of a lag here. So this morning, we're going to take a few minutes and do some member polling. We believe it's really important to keep the real operational issues in front of us to be discussed with the state as we talk with them on an ongoing basis. So we really want to know what's going on with the residents. We really want to know what's going on with the providers to inform those discussions and update what we think and know. We know we'll never have accurate day-to-day assessment data that we can put in front of the state, but we want to quantify things a bit more. And we're going to try to use our Friday webinar for that purpose, if it works out well. So we're going to look at things that, first of all, the state doesn't monitor at all, which is laboratory turnaround time. And we know that that's a big issue with weekly testing and the surge in tests that are going to the laboratories, that the laboratory turnaround times have become a major issue, or they still are, let's say that. We also want to think about current caseloads in different settings and staffing. So we have a few questions that we hope that you'll help us learn a little bit more about those things. So the first question is about testing result timing. For state-managed testing, in other words, if the state's doing your testing and or the state health department is doing the test itself, we want you to answer this question. Your average turnaround time for reporting, is it 1 to 2 days, 2 to 4 days, 4 to 6 days, or more than 6 days. So Blake, if you could put up that poll, we would like to hear what's going on with our members.
All right, I will go ahead and launch that poll now. So you should see that on your screen, I believe. And we'll just give that, we'll say maybe a minute or so to make sure everybody get their responses in, and then we can go ahead and see all the responses. Thank you. All right, I'll just give this another 15, 20 seconds or so. It looks like we've had about 30% of the participants vote. So if you could just go ahead and read that off and just give that a quick answer. All right, it looks like it has been about a minute and we haven't had any since. So I will go ahead and close that poll and we will share the results of that.
Okay, so it looks like about 2 to 4 days. And I'm assuming that these responses are mostly from nursing homes who are doing weekly testing. Okay, great. So let's move on to the next slide. So the next piece is about those using private commercial laboratories for testing. The same options are available for you. And remember that we understand that this is mostly going to be nursing homes who are doing weekly testing. But if there are other entities such as assisted living that are also doing some testing, and you have a sense of what your turnaround time, we would like to hear from you as well. So Blake, please put up that question.
All right, that has just been launched. So again, we'll wait, 45 seconds, a minute. Let's go ahead and vote, please. All right, we are definitely getting more responses, so I'm assuming a majority of people or more people are using the private commercial laboratories is what it's seeming like. All right, I'll give this another 15 seconds or so. If you haven't voted, feel free to, and then we will check out the results for this. All right, I'm going to close this one, and we will go ahead and share the results on that.
Oh, well, it's a bit better than state lab, but still predominantly taking about 2 to 4 days. So thank you very much. The goal here is to perhaps, if this works, to use these standard questions on a routine basis so we can identify trends and changes and put them in front of the state immediately as they occur. So I thank you for your help in having us do that. So this question is for nursing homes only, and we want to make sure that the staffing issues that everyone's having, which are so critical, that the state understands the impact of that. So we just want to get a sense of what your average nursing staff hours were. And I know that you're all used to kind of reporting this. If you aren't aware of your staffing hours for the last 2 weeks or so today, that's fine. But if you do, please identify what level your staffing in hours per resident day was for the past 2 weeks, thinking the same way as you would report it to CMS. So Blake, go ahead and put up that question, please. Also note that if you can't maintain a dedicated unit, so you can select one, I'm hoping that this is they can also select number 5. So they can select more than one here, Blake. Is that what it's set up to do?
I don't believe so for this one. I should be able to change it right now, I think, though.
Okay. because we also want to know whether or not, I know that a lot of people told us last week that you couldn't maintain a dedicated unit because of the staffing issues. We want to put a few numbers. We want to know how many of our members who are attending these calls can't maintain a dedicated unit because of staffing. I think that'll be critical going forward when we inform the task force of some of the issues around those regional hubs and dedicated units.
All right, I believe it should be updated now.
Okay, so please select more than one is needed. The first 4 questions, obviously you would only, the first 4 responses, you would only pick one of those, but you could pick the 5th response as well.
All right, well, it looks like it has been about a minute and a half on this one. Did you want me to close this one or wait a little bit longer?
If they have stopped submitting, if you think there's a pause there, then go ahead and close it.
All right, we'll go ahead and close this, share those results.
Okay, 60% are still staffing between 3.5 and 4.0. Okay, good. Okay, good. No one greater than 4.0. That's a little unusual for some of our members. Okay, next slide. We want to know about staffing in other settings, predominantly assisted living, AFC, HFA. So there are several things here that you could identify, because we don't believe that you measure staffing at all the same way that a nursing home would. So the first 3 pieces is whether you've been able to maintain your pre-pandemic levels of staffing, or the second option is it has decreased somewhat, and the third option is it decreased a lot. So we understand there's some subjectivity here, but I want to be able to go to the department and say, well, 30 or 40% of our providers say it's decreased remarkably. So pick one of the first 3. 4 and 5 you could also pick if you've had to limit admissions because of staffing levels, and or you can't maintain a dedicated unit because of staffing needs. So yes, thank you, Blake.
All right, I will give this about another 15-20 seconds. So if you have not voted, please go ahead and put your vote in. All right, I'm going to go ahead and close this one. We can share the results for that.
Okay, wow, 58% cannot maintain a dedicated unit because of staffing. Okay, great. Okay, the last 2 slides are for caseload discussions, and we know that polling for information about caseload is kind of tricky because many of you have more than one community that you're representing. This first question is only for nursing homes, and these are kind of broad strokes, we know that. But we want to identify, based on the number of nursing homes you manage, whether or not you've had any COVID positive patients ever, or you've had a new case in the past week. So the first 2 questions are only for members who are representing only one nursing home. Either you've had no facility-acquired COVID positive residents, or you have had one in the last week, or number 5, none of the above is true. In other words, you've had some in the past, but you don't have any now. 3 and 4 are if you're managing more than one nursing home, but the same questions. you've never had any facility COVID positive residents, or you've had at least one new case in one of your nursing homes in the last week, or do none of the above apply. So Blake, put up the poll, please.
All right. And Deanna, I did want to say I had a question come in, so I figured I could just go over that while people are answering. It's more of just a comment, but they said, Deanna, for your statistics, some facilities may have had several folks on the line and may have duplicated responses.
Okay. All right. Thank you. We'll note that.
All right, so I'm going to go ahead and close this one. It looks like it has leveled off. I can share the results on that.
Okay, great. One SNF and no facility acquired COVID is 58%. That's good. More than one SNF and no is 0. Several SNFs and have had a new case in the past week, 21. Okay, thank you. Thank you very much. So we're going to now ask the same set of questions to non-nursing home, residential settings, AFCs, HFAs, and assisted living. So please answer the same set of questions in the same way, except only for non-nursing homes.
All right, I'll wait about another 10-15 seconds here. Looks like voting has leveled off, sort of. All right, and we will close that and share the results on that.
Okay, so it looks like a lot of our members have had some COVID, but not so much now, except for multi-facility members. Okay, thank you. So we appreciate you all taking the time to respond to these questions. The next 2 slides here are key messages. They are a summary of our polling issues from last week. We discussed a lot of the responses in detail on Wednesday, but I have narrowed them down into a list of high-level issues that we want to make sure we're communicating with the state about on an ongoing basis. So for the most part, on this first slide, there was general consensus about 1 through 6. We did receive some comments that might have, we're not 100% sure, identified some differing views about independent living. Some definitely thought that they should not be covered under any of the governor's executive orders, but others did not specifically say that. So what we've said here is that we've included language to state that independent living is different and simply should not be included in any blanket directives for health facilities. And part of the issue is about, how blanket directives apply across the board anyway. That's a huge message as well. So these are things, again, review them at your leisure. If you think that there is a major missing comment that needs to go to the state, please let us know. There are more on the next slide as well. So these were a little bit more complicated and required a little bit more words in order to describe them. Basically, one of the big takeaways that at least I had was about the fact that they need to think about the system rather than individual provider levels, and providing resources piecemeal, which, you know, upsets the apple cart in many ways. The need for continuation of those staffing flexibilities, things around dedicated units and regional hubs, and then overall funding. We believe that we've captured member sentiment well, but again, please review these, and if you think that there is a major point here missing that we need to be saying to the state, please shoot us an email to Safe and Calm, our dedicated email. So with that, we'll take questions and comments about any other member issues that you might want to bring up now.
All right. Again, Leading Age Michigan would like to thank our business partners. Just a quick reminder to take a look at the logos on this screen, as they help both our association and your guys' organization. We wouldn't be able to do as much as we can without all of these organizations. So if you guys are looking to purchase any type of goods or services, just please remember all the logos and the names on this screen and consider purchasing from one of these organizations. As of right now, I actually do not have any questions.
Okay, well then let's move on to our resources and updates. So we start with the CDC updates, I believe. Yes. The CDC did have a couple updates this week that were pertinent to us. This was an updated guidance. I think it was done like 2 days ago for retirement and independent living facilities. The CDC definition for these facilities that should be considered under this specific guidance includes public housing, assisted living homes that do not provide medical services. That's their language. I think we would not call that assisted living here in Michigan. But our take is that it would include senior housing with or without communal activities, and they also include CCRCs. So the new guidance, thank you. The new guidance includes a set of guiding principles, none of which would surprise us. Number one, that seniors are at risk both because of their age and frailty, and also because of the fact that in these areas they're living in communal settings. The other principle is that any guidance for these kinds of settings should be considered within the local circumstances and with the help of local and state health departments. So even though the CDC puts out guidance, how that's technically applied in every state needs to be determined by the state and local health departments. So this part isn't new. I think we went over it once before. The CDC has developed some risk categories for independent living and retirement communities. They're not risk-based on the type of facility, but they're risk-based on considering the resident and administrative behaviors. So we believe that their intention here is to identify levels of safe behaviors, but the application of these would depend on local circumstances and guidance. Obviously, you would not need low-risk behaviors, which would mean no internal or external visiting, and closure of all communal areas. You would not need those if indeed you didn't have significant community transmission. So this is just how CDC defines the riskier behaviors, the better behaviors when needed. So this next slide is a summary for the rest of the guidance. There are resources about emergency and pandemic planning, and we have included the links for those. The new pieces are highlighted in green, and there are detailed guidance for different communal areas in the residential community. And it talks specifically how to employ safe practices for each. So if you have a a common kitchen, a common dining area, common activity rooms, other kinds of common activities. There's some specific guidance about how to be safe in each of those areas, and we thought that might be helpful. There's also some basic operation guidance and some considerations about what to do if someone should become ill with COVID in this level of facility. So in the CDC updates since Wednesday, we noted that there was one from Dr. Robert Redfield. He is the current director of the CDC. So he responded to an article that was in the Journal of the American Medical Association, I think in the last week or two. And what he wanted to say was the media reports about the actual spread of the pandemic he felt were exaggerated. So the article in JAMA pretty much said that there could be up to 24 times more cases than reported. And he wanted to make it clear that the CDC on average says that they believe that there are only 10 times more cases than what was reported between March and May, which in my head is still a significant number. He believes that the one state who had these extremely high numbers was basically because of underreporting and undertesting previously. So the CDC came out with this idea. And so the takeaway from this is that because we're not testing everybody all at the same time, they estimate that there could be up to 10 times more cases than reported. The other thing that the CDC updated that would be pertinent to us is its clinical questions. These are the FAQs based on all the topics that we have listed here. You'll note that some of them are very pertinent to us: testing in nursing homes, testing overall. A lot of care of specific kinds of patients who might be in our facilities. So this is a good page to look at if you have questions about any of these areas that may not have been answered by the standard CDC guidance for health professionals. It's just meant to be a resource, and the link is at the bottom of the slide. Well, this is our executive order update for the past week, or at least since we last reported on these. The governor did extend the declaration of the state of emergency to August 11th, which is, of course, critical since a lot of the other provisions were dependent on that. And she did that probably about a week or so ago. And then, of course, there was the general mask guidance that was also issued for everyone in public. And late yesterday, she created the executive order to adjust the budget on reduced state revenues, which Dalton spoke to a little bit ago. And late last night, she extended the visitation restrictions. So that is the one that is going to be most pertinent to us, Executive Order 156. So overall, the visitation restrictions were completely unchanged. You have continued healthcare screening requirements. You have cloth covering requirements. You have to make best efforts to facilitate visitation. And of course, last but not least, it still includes all of the same settings as it did before: homes for the aged, nursing homes, AFCs, substance abuse, independent living, and unlicensed assisted living facilities. So she has not changed any of those pieces as of yet. So our next slide talks about a report that we came across that I thought was pretty interesting. Dr. Tom Frieden, who was the former director of the CDC, is currently working for a not-for-profit group that's looking at data reporting. And they did a state-by-state review of COVID data and reporting. And one of their big issues is that there is no national standard for any of this. So what they did was they identified a set of detailed indicators, measures, standard requirements, and then they measured each state against them. The highest score was only 43% by Minnesota. Michigan scored 27%. So this is the study that identified that there is no state right now at all measuring and reporting lab turnaround times, which provoked our questions earlier. Now they get anecdotal information about it, but they don't really measure it over time, and they're certainly not reporting it. So they have major concerns about a lot of these measures. If you want to read the report and the state-by-state findings, the links are included here. HHS has issued a memo that details the timing for reporting for members who have received provider relief funds. Members might note that the original plan was to have members report only if they received $150,000 or more. But they've since changed that to only $10,000. So a lot more of our member facilities are going to have to report. They still have not issued the reporting details. We're going to look for that. But providers can start to report for this year on October 1. That's when the system will open. And final reports for any spending during this calendar year will be due in February. And any reports for additional spending that might occur in 2021 will be due at the end of July. We've been talking the last week or two about finally getting access to Medicaid-only grants. Those provider grants are for providers who did not receive any money under the Medicare-based grants. So for those Medicaid-only providers, there are two webinars scheduled on Monday. One is from HHS, and one is from the Michigan Department of Health and Human Services. The registration links are here, and also the HHS link for more information about these grants. HUD has, I think this was yesterday, HUD issued their notice finally for supplemental payments. So these are grants for Section 8, Section 202, and 811 programs. The link for the entire guidance is listed here. There is an August 5th due date for requests, so that's not very long of a period before you have to have your request for monies in. And you have to actually request the monies, which is different from the grants for service coordination that came earlier. So there are limits for funding, and they're listed here. And the application link is also here at the bottom of the slide. A couple of federal updates. The federal state of emergency was set to expire tomorrow, and by close of business yesterday, it still wasn't extended. However, late yesterday, HHS did extend it for another 90 days. That's really, really important because all of the waivers, the blanket waivers, and other programs are definitely dependent on the fact that we still have to be under an emergency declaration. So right now, it is extended until sometime in October 2020. The House and Senate have set a goal to complete legislation next week for the next stimulus package. They hope to get it done by the end of next week. The Republicans, according to the media, are trying to ensure that some provider liability language is included that would have to be applied by each state. Right now, the language includes a waiver of all liability related to COVID, except for gross negligence or willful misconduct. So we are certainly in support of that. We'll have to see how this plays out. Leading Age's take on this is that this is, of course, a good start, but there's not enough money here to really move the needle. So the National Governors Association memo, they issued and updated this long memo for long-term care. And I guess we were hoping for something a little exciting here, but in that respect, I guess we were a little disappointed. There were no real surprises in terms of their recommendations. What there was, though, is some best practices identified in other states. It wasn't a complete review of what was going on in all the other states based on these listed considerations. But there were staffing and testing best practices from a couple states included, but we didn't feel that there was any new information overall. But it is a good overview if you want to look at some of the states who are doing the most innovative things in terms of these areas. Last but not least, we need to talk a little bit about point of care testing. And to be honest, at least I am still a little confused about all of it. It is indeed an antigen test and not an antibody test. So it does have the capability to detect current illness. But some sources, not the CDC, mind you, but some sources and expert papers still say that there are concerns with using it, and some of the sources state that antigen testing needs to be repeated using molecular tests. It's not clear whether or not they mean just the positives or the negatives, or so we're not sure about that. But you know, looking at all of the research and sources of information, it does clearly identify positives. This test will identify a positive well, but there's an awful lot of false negatives, and that's, I think, what's concerning a lot of people. So this could work well for serial testing, since based on the most recent CDC guidance, members would keep retesting negatives, which is what you're going to have to do with weekly testing anyway. And especially if you use the new CDC guidance, once the department updates its testing rules, you wouldn't have to retest positives for 3 months. So this could be very, very positive, would be a lot easier to deal with than our current testing plan. So we'll have to see how that plays out. We still don't have a list of priority nursing homes. And we know that it's going to take a while for these tests to get all around. So that ends our update for today. Blake, let's go to any questions.
All right. I will pull up the first one right now. What steps need to be taken to get some of the $5 billion? Can you provide a link to the required training?
I'm not sure if that's been detailed out yet. We will look into it. If there is the required training, if you're talking about the required training, I don't believe that that has been put out there yet.
No,
it's also not clear. I'm sorry, what?
The training is not out yet.
Right. It's not been out yet, and it's not even clear what level of staff the training is intended for, whether it's administrators, nurses, DONs, administration, CNAs. It's not really clear. We do know that there's 23 modules. We have not seen that yet, but as soon as we know more about it, we will let everyone know. And I don't think that the requirements for the $5 million are out yet either, are they, Dalton?
No, the president just announced this in a press conference, and it has not actually gone through CMS or been established in a CMS rule. So CMS still has a little bit of work ahead of them to get this rolled out.
Right. And it's $5 billion. I said $5 million, but I meant $5 billion. Okay, next.
All right. If a SNF obtains COVID-19 testing equipment, can it bill MC Part B for the tests of residents in addition to getting reimbursed by the state for collecting the samples?
I don't know. We'll have to look into that, talk to some of our billing experts. I'm not sure what you would be allowed to do if you're doing the testing yourself. It's possible that you could, charge insurances just like, you might anything else, but let's look into that.
All right. Any idea when assisted living reporting is going to be made public? Just questioning why AL communities are being required to report weekly if no one is looking at it.
That's exactly my point as well. It's a concern that I've shared with the state numerous times. We would like to see some transparency there. I suspect there's a reason, but I don't know what it is. It could be that they don't trust the data. But they have never responded and talked to us about that. So it's something to look at. We have not gotten any message that I'm aware of that they plan to publicly report it, although we encourage them to do that.
All right, and then just a quick reminder, I did switch the slides, so if you do have any questions, we have our emails right there in the bottom left corner, so you can shoot them off to the Safe and Calm, and that will go to multiple members on the team. Or if you have a direct question for Deanna, Dalton, or Laura Funch, you can see their emails there as well. I do not have any other questions, so we would like to say thank you to both Dalton and Deanna. Thank you to everyone for participating in the polls today, and we would also like to thank, I believe we had around 50 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. Deanna or Dalton, do you have anything else that you would like to say?
Just want to wish everyone a very quiet and safe weekend.
Yes. Thank you for attending.
All right, thank you, and everyone have a great rest of your day and have a great weekend.